My name is Daniel Malone. I'm the current DESC Executive Director, and I'm going to make a few remarks, and then we've got some additional speakers who are going to add a lot to the content here this morning. But this day is especially important to me because the space that we're in right now is where DESC was born 46 years ago. And the new use that we're about to put this space to is rooted in the same values that led DESC's founders to open the doors in the first place, way back when. So I want to direct your attention to this blow up of a newspaper clipping from the Seattle Times, 1980. And this is our first known media coverage of DESC as an organization after it had started at the end of 1979. And it captures the spirit of DESC and what it's for just in the headline alone. We accept everyone here, which was referring to the intent that the founders had to welcome people in as who they were, in whatever condition they were in, and then do our best to meet the full array of needs that they had. And that included bringing people in who were experiencing symptoms of serious mental illness and people under the influence of substances. If you look closely at the photograph that accompanies the article here, later, I guess, you can see that it's taken in this exact space right here. So this fireplace right here is in the photo, and the windows behind me are also in the photo there, right here next to the original skid road. So this is the spot where DESC's commitment to helping people who were accustomed to being excluded really began. The shelter that was here was an amazing place. It was providing refuge from the streets for well over 200 people every single night for more than 40 years, 14,754 consecutive nights to be exact. But squeezing in lots of people with high needs into shared space made for a difficult environment. When COVID arrived and forced us to move to a non-congregate environment to prevent the rapid spread of the virus among so many medically compromised people, this space was emptied out after all those years. We decided not to return to use it as a mass-scale congregate shelter for people with complex problems, and have been plotting out how we could use it because it's such a large, bright, beautiful space for more ideal purposes ever since. So, in keeping with DESC's value to accept people as they are, in whatever condition they are in, and for who they are, it's fitting that what we're celebrating today is a clinic that does just that. We will use this space to provide our array of outpatient behavioral health services to people with complicated and long-standing psychiatric conditions, to people with hard-to-treat substance use disorder, and people whose lives have been beset by challenges, traumas, and setbacks too numerous to count. One pithy phrase that captures the spirit of this work is, "We meet people where they are, but we don't leave them there." This will all come into focus much better when you hear in a bit how we deliver these services and what our clients will experience. The newest of the services that are being added as we open this space is the ORCA Center, the Opioid Recovery and Care Access Center. This adds a new layer to DESC and to the community's array of interventions to overcome the opioid and fentanyl crisis. This will be an always open program where people who just experienced an opioid overdose can come in for medical stabilization, treatment initiation, and connection to ongoing behavioral health support. It enhances the opioid treatment work we have had in place for many years here at DESC, which has really hit a strong stride recently with an innovative way to start people on buprenorphine that has become quite in demand. You can read all about it in a recent article published in JAMA Network Open. Having more opportunities to connect with people shortly after overdose events and more capacity to take walk-ins, as the ORCA Center will have, will bring effective, good quality treatment to many more people. This is so exciting because it's rooted in those values of accepting people in whatever condition they're in, even if they're still using fentanyl. The most important thing we need to do today is acknowledge the many partners and people who made it possible to bring this wonderful space to new life. So please accept in advance my apologies to people that I am going to leave out here, inevitably. For the most part, I'm not going to name individuals, but because there are just way too many to count, but there are some individuals I'm going to work into this. So there isn't a particular order to this list, so let me get to it. The first catalyst in this process was Caleb Bantagreen from the UW Addictions, Drug, and Alcohol Institute. Caleb has been a leading researcher and voice for addressing the overdose crisis for so long, and it was his vision to get research funds to study an overdose stabilization facility that got the ball rolling for this. He just needed a provider with a space to do the work, and he made a persuasive case. Thank you, Caleb, for your great partnership. We also thank Caleb's many UW ADAI colleagues for all of the planning support for the last 2 years. I want to call out specifically Mandy Sladkey and Kelly Youngberg for that work. Among the many great contributions of ADAI is the establishment and facilitation of the Lived Experience Advisory Board, from which we got essential, unvarnished recommendations for what we should do and should not do in this work. The Seattle Fire Department sees more of the overdose crisis up close than likely any other entity in our community. They continue to innovate care via things like Health 99 and 98, providing buprenorphine in the field, and advising partners like us in our work. Thank you especially to Chief Scoggins, Medical Director Michael Sayer, and John Ehrenfeld for all the support in this. King County was the first government partner to make a large funding commitment to this project. The Behavioral Health and Recovery Division is an essential partner in all of DESC's behavioral health services and will be an ongoing partner in our operations in ORCA and the other components of this clinic. You'll be hearing from Executive Braddock in a few minutes, and thank you to King County. The state of Washington, both the Healthcare Authority and the Department of Commerce, were instrumental in providing capital and operating support for this work, and we thank them as well. Harborview Medical Center, whose downtown, thank you. I don't know if I should just blow through the clapping or stand. All right. Harborview Medical Center, whose downtown programs provide physical health services to DESC's clients in this clinic, other outpatient clinics, and many other DESC settings, and whose addiction medicine experts have been key advisors about ORCA, is another key partner in this work. Thank you, Harborview. The City of Seattle is another key funding partner for both capital and operating of this clinic. Many thanks to the Mayor's Office and the Human Services Department. You'll be hearing from Mayor Harrell shortly as well. Thank you, City. The city's capital contributions originated from the U.S. Department of Housing and Urban Development's Community Development Block Grant Program, which is an essential program that Congress needs to continue to fund. Thank you to HUD. Public Health Seattle-King County has been a major participant in our planning efforts, as has Evergreen Treatment Services. Thank you to everyone in those organizations. Some of the key parts of the development team for this facility are Absher Construction. Eric Lee and so many others did the fastest possible high-quality construction job you could hope for. SMR Architects, Foster Garvey for legal support, and Impact Capital. Thank you all. I want to also thank WellPoint Washington for your historic and ongoing commitment to DESC's mission. Our Pioneer Square neighbors continue to be awesome, very collaborative and interested in our success. Thank you, neighbors. The DESC Board of Directors continues to let me work here, and they're always supportive about taking risks for the good of our clients. Thank you to the DESC Board. Most of all, everyone who works at DESC has a hand in this. This is where I truly wish I could name everyone because so many deserve it. For now, I'm just going to call out our real estate development team, Sandra Nielsen, Brittany Meek, Jared Odell, and so many others, along with our facilities team for getting all of this ready. Our clinicians and medical and clinical leaders, Richard Waters, Kaylin Folkley, Rachel Marhill, Tyree Long, are standing up a complicated new program in the ORCA Center. Thank you for your leadership. Our other clinical and medical leaders are leading the transition into our new clinic. Louisa Kwok, Kayleen Chung, Katrina Plewinski, April Gerard, Sheila Smith, Winnie Aguazam, Carly Stevens, Lisa Grillo, thank you all so much. Our information systems team, getting our technology set up, along with enhancement of our data systems for these services here, doing an amazing job. Our finance team, making all the money flow right. Our fund development and communications team producing this event, along with so many other things. I wish I could name them all, but thank you to all my DESC colleagues. Okay, finally, before we got any of the government funding commitments, we had a visionary seed gift from Peter Shapiro. This made everything else possible. We would have been stopped in our tracks without you, Peter. To honor this, we are going to present you with a casting of an original doorknob from the Morrison building. This is one of the old doorknobs, and look what we did with it. There's a little plaster cast of it and a commemoration and thank you to Peter and, scene from the clinic here. So I'll be giving this to you here shortly. Thank you so much, Peter. The doorknob symbolism may be too on the nose, but obviously opening doors for people. So thank you so much. Okay, so, maybe my job here was just to introduce speakers, and now I've taken up all this time, so thank you for indulging me in all that. I do want to make note of many of you picked up a program when you got here, and there's a cool graphic in that called Jimmy's Journey, and this will help you get a sense of the larger continuum of services we're building here, in addition to the clinic we're celebrating today, so please check that out. I'm about to move into our other speakers here and want to take just a second to acknowledge many of the elected officials who've joined us here today. Thank you for being here. From the legislature, we have Emily Alvarado, Brianna Thomas, and Nicole Macri, maybe others. Council Member Barone from King County, thank you. We've got at least a couple of Superior Court judges, Judges Shaw and O'Donnell, thank you for being here. And then, of course, we've got the two top people of them all, County Executive Shannon Braddock and Mayor Bruce Harrell. So I'm so glad to have everybody here. Okay, so let me get to it. First up is King County Executive Shannon Braddock. DESC is grateful for your leadership in advancing improvements to the behavioral health system and homelessness response system, including this project today. Executive Braddock, thank you for being with us today.
Wow, good morning, everybody. I just want to spend time basking in the awesomeness. I'm not going to lie. This is really remarkable. And I would like to give a thank you to Daniel Malone, because I think we have an amazing leader. So, the opening here really caps the significant progress that we have made to build the infrastructure and the response that we need to address the opioid overdose crisis. I was able to tour the facility yesterday with Mayor Harrell, and I have to tell you, I just walked around with kind of a random grin on my face on and off all day, reflecting on this space. This space is so respectful to the people who work here, to the clients who need the services provided here. And I loved Sandra Nielsen described it as a legacy space. And I think that is just the perfect encapsulation of what this space means. And I just want to say with great appreciation, this to me is a manifestation of the work that so many people do to care for the people in our communities who are most in need. So last spring, King County announced 13 actions to address the surge of fentanyl overdoses that we were seeing, and we wanted to expand treatment, increase access to medications for opioid use disorder, and really make overdose prevention resources more widely available. And the opening of this ORCA Center marks the 13th completed action of those 13 actions in the last 12 months. Yes. So as you heard from Daniel Malone, there is an unprecedented level of coordination across all levels of government and the partners who work with government who have joined together to prevent overdoses and save lives. And we now have more places for people to go to get treatment. This ORCA Center, a larger sobering center, King County's first crisis care center, a new residential treatment facility, and the STAR Center all opened in the past 12 months. So, despite the grim federal landscape that we are seeing, locally, we have been able to make headway and quite literally open doors. Thank you, Mr. Shapiro. And so, that obviously is in no small thanks to people like DESC and the leadership of DESC who helped make these things happen. For decades, DESC has been central to this progress. And we have supported and invested in King County in that kind of programming, partnering closely with DESC. They've run our King County Mobile Crisis Team since 2012, operated our Crisis Solutions Center, the new STAR Center, and this ORCA facility. And they've championed initiatives like our crisis care centers all along the way. King County is incredibly proud to have supported DESC as they also pioneered developing permanent supportive housing models to support safe, healthy, and affordable housing for people living with behavioral health disabilities and experiencing chronic homelessness. DESC has also leveraged, as Daniel referenced, the local behavioral health sales tax to pioneer a new method of a more accessible and longer-lasting medication for opioid use disorder. The opening of this ORCA Center means that our partnership will continue. There will now be a place to provide 24/7 care for people who have experienced an overdose. We know treatment is vital. King County is focused on making sure that everyone has access to the care they need and the ability to recover from their addiction. We do so thanks to the work of DESC and their dedicated staff and partners. I cannot say enough about how amazed I am by the work that the folks do, not just who work with DESC, but I also want to give a shout out to all the local government folks who work in these human services space, whether it's through policy or direct client services, for the people most in need. That to me is just an amazing public service. And I also want to give a shout out to all of the nonprofit partners, the foundations, the agencies, everyone who is paying attention, responding to the crisis as needed, and stepping up. It fills me with hope, and this is hope in action. So thank you so much to everyone here who has participated in that space. Delighted to be here for this kickoff, and thank you for having me today.
Thank you, Executive Braddock. Next up is Seattle Mayor Bruce Harrell. We appreciate Mayor Harrell's continued commitment to supportive housing and other housing for vulnerable people, as well as working with us to strengthen our continuum of services in this area with the recent addition of the Star Center, as was mentioned, in addition to this clinic project here. Mayor Harrell, thank you for being with us today.
Thanks, Dan. Shannon's getting really good at giving speeches now. You're firing me up. My goodness gracious, I don't like going in back of you anymore. I've seen your game go up here in the last several months. So, as Executive Braddock said, Daniel, and to DESC, I described in our tour yesterday after an interview, I said, this is sort of a critical missing link in the continuum of that intersectionality between health and housing, public safety. Peter, I'm going to use you as an example. I don't know where inspiration comes from when someone sees this as a vision. And I'm preaching to the choir. All of you that are here, you had some inspiration to help people. I don't know where that comes from. I'd like to think that there's some kind of divine inspiration that's sort of embedded in us, and we say, I'm going to go to school to be really good at this stuff. I'm going to use my relationships and my energy to be real good at this stuff. I'm going to take the most precious thing that I have, and I'm going to be real good at this stuff. For me, that's what we're celebrating. When I gave an executive order, issued an executive order to address the public health and safety impacts of the fentanyl crisis, and we decided a couple of years ago to invest in this facility, I actually got teary-eyed during a press conference, which I was always told by my comms people, don't let them see you sweat. Well, they didn't see me sweat, they see me cry. They'd see tears. And the reason that happened is, some of you that are seasoned, like me, lived through the war on drugs. And what I saw was when I see people that are killing themselves, these are not strangers to me. These are people I grew up with. And it brought tears to my eyes because I thought about people just for smoking marijuana that were doing years and years and years of prison time for something of just smoking weed back in the day. So when we lived through the war on drugs and what we're seeing now with the fentanyl crisis, it becomes very personal. But I have to say, we take victories where we can. The fact of the matter is that even without this facility, overdose deaths were down about 20% last year in the county. This is some great work. Now imagine the magic we could do now with this facility. And the term ORCA, I don't know who thought about that acronym. That was brilliant. Imagine what we can do now. And we have a crisis care center online as well, many of them coming. Imagine how we can actually win. That's what we're here celebrating. So I had a chance to tour the facility yesterday with Dr. Taralynn Folkley, and she spent, is she here, by the way? Was she, can you reassure? Yeah. Dr. Folkley, I sometimes ask people where do they find inspiration from, and I find it all around me. You inspired me yesterday. You told the story about when you were working in the emergency room, and I won't tell the whole story, but you talked about how, in short, how this was a vision of what you needed to really save lives. And it was very impactful. I didn't cry, but I felt energized and inspired. So thank you for that. So with this facility, our first responders can bring survivors here to get them stabilized on medication and begin conversations about treatment. It starts with that human touch, if you will. Combined with our fire department's first in the nation buprenorphine pilot, a Health 99 team, our care department, which we started from scratch, their behavioral health responders, we will find a way to help people in crisis and find a pathway to recovery and well-being. So like this magnificent center that's been around for a long time doing just outstanding work, we think that it's going to take these kinds of connected human wraparound services and pathways to housing to ensure long-term stability. The good news is that we're proud to fund 320 new units of permanent supportive housing that DESC plans to open this year and next, and we're very excited about that. And you may recall this week we made an announcement that we are going to invest a record $170 million in affordable rental housing with a focus on permanent supportive housing for people exiting homelessness and housing for families earning 0 to 30% of the area median income. And I have to explain to you in closing why that's so critical for the City of Seattle's strategy. We recognize that our hearts are always pretty much in Seattle. We're in the right place. Contrary to one of the most idiotic statements I've ever heard in my life, referring to the city that I was born in as a crap hole. You know what I'm talking about, right? No, you don't. So Donald Trump Jr. referred to Seattle as a crap hole with Portland. That was wrong on so many levels. I don't even think this guy's even been here before. We're saving lives here in Seattle. We're a city of innovation, a city of compassion, a city of empathy, a city of forward thinking. We are on the map because we are a wonderful city. But this work is so important because we recognize, with our hearts being in the right place, that affordable housing developers, it's ungodly expensive to maintain them. The cost of insurance, the cost of repairs, the cost to treat people. And we will continue to invest. We don't get tired, we get energized. So this $170 million in affordable rental housing with an emphasis on PSH is the right thing to do. And so we are there with you. I close by saying I know I'm preaching to the choir, so as your mayor, I thank you from the bottom of my heart for this kind of approach, and this will be where the magic happens, because this is where we will save lives. Thank you very much.
Thank you so much, Mayor Harrell. I am really delighted to be able to introduce you to my colleague, Taralynn Carter, who is going to come up and explain to us a little bit more about how things are going to work in this clinic. Taralynn is our drop-in and client engagement supervisor here in the Pioneer Square area. She's a peer specialist who has the privilege of working directly with DESC clients, supporting them on their recovery journey, and she's going to give you a glimpse into how vulnerable people are welcomed into our clinic and the services they will receive. So, Taralynn, welcome.
Hi, folks. My name is Taralynn Carter. I am, as Daniel said, the client engagement peer supervisor here in Pioneer Square, and that means I am the person who works with the teams who welcome folks in every day. They're the folks who are out on the street, who are supporting our relationships with our neighbors, and welcoming clients before they may know that DESC exists. They help them find the front door. I also work with the folks who run the drop-in center, and that's the space that you're sitting in right now. DESC's Lou Middleton Drop-In Center has been operating since 1994, including all the way through COVID. We were welcoming people in our space. And that looked different during COVID. It meant that we had limits on how many folks could be inside. It meant that we were very careful with how we were disinfecting, that folks had to wear masks, but we continued to welcome people throughout that. And as we move into this new space, I really hope that we are continuing the tradition of welcoming people in that same way. I remember on one of my very first days working for DESC, I understood the type of work that I would and could be doing it here. When I met an individual outside, he didn't know what DESC was. He wasn't sure how to find us, but he had heard that there was a place that he could get help. He was a person who was experiencing severe alcoholism, who was in and out of the hospital for head injuries related to that, and he was at a point in his life where he no longer had hope. And I had the opportunity to literally sit with him on the street, to hold his hand, literally and figuratively, and to provide him hope in a time when he didn't have any left for himself. For folks who are not familiar with what peer specialists are individuals who have lived experience that's relevant to the clients that we serve. And that can look like a lot of different things, but the most important piece of that is that we provide hope in recovery. And sometimes we are providing that for folks when they don't have that hope left. Sometimes we are helping them hold that hope up or providing an example of that. But that is often the first thing that gets folks through the door for us. Once folks are through the door here, we welcome them with a hot cup of coffee. We have food available for them, but we also have an array of services here, alongside the ORCA Center that we have certainly heard a lot about, and the OTN program, who's providing medication assistance for folks who are experiencing opioid use disorder. We have a range of clinical programs like HOST. HOST is Homeless Outreach, Stabilization, and Transition. Now, my apologies, the social services and DESC is a bit of alphabet soup with our acronyms, but it's good soup. I hope you will make a meal of it with me. HOST. Our team at HOST, Homeless Outreach, Stabilization, and Transition, goes out into the community. They take referrals from folks like you or me, our neighbors who see folks in need. They put in referrals, and then our teams goes out into the community to find those folks in need of help, to build relationships with them, and to bring them to a place where they are able to access services. And that can be a long road. It is a non-traditional service model, and it takes a high degree of personal connection to make that happen. We also have a program here called SAGE. It's Support, Advocacy, Growth, and Employment. And that's a more in-house traditional case management model where folks who are able to find DESC and say, hey, I know I need some kind of help, they're able to come, walk through the door. We do drop-in intakes almost every day of the week here, and folks are able to access services. Once they're here, there is a welcoming space for them to be. There are case management, but also other more supportive services or wraparound services like wellness recovery action planning, like affinity groups, like connections with peers. This place is holistic. This place offers so many opportunities and channels for people to connect with services. I want to close with a story about another person that I have had the privilege of working with here. And that was an individual who experienced what I refer to as generational homelessness. And this comes as a surprise to a lot of people, that some of the folks we work with have never in their lifetime had housing, that their parents never knew stable housing. Perhaps their grandparents did not have housing or never knew stable housing. And this individual was a person who my peers team walked alongside and demonstrated hope and recovery for a long time for them. And they were very ambivalent about housing because housing was scary. It was something they had never known before. It only represented a trap. It was fear for them. And this person, after walking alongside them for many, many months, more than a year, I got to have a conversation with them that said, hey, what does housing, good housing, housing that sounds welcoming, that you would want, what does that look like? And I was able to walk around Pioneer Square with this person and have them point at buildings, DESC buildings, and say, that place looks like home to me. That place is a place I can live in. That place has community. And if I'm getting teary, and if I sound sanguine in this moment, that is my passion coming through, and I hope you all hear that and see that and join me in that passion, because I do believe that this work is truly meaningful, that what DESC is doing here is truly meaningful, and that it is providing pathways to recovery, that it is providing hope, it is providing a future for people. Thank you.
I've never been so happy to be the worst speaker on a panel than today. All right, we do have one more speaker that you're going to want to hear from. So, Royce, are you here? Royce received services from DESC and is going to tell you all about that.
Hi, everyone. My name is Royce. I want to talk a little bit about my experience, especially living at the Navigation Center and permanent housing since then. And getting on Sublocade with the help of this OTN staff. When I first moved to DESC's Navigation Center, I was still figuring out how to stay on track with my recovery. To be honest, it wasn't easy to start. New routines, new faces, a lot of uncertainty, not knowing what the next day would look like, trying to figure out something else that would work for me instead of what I was regularly doing. OTN reached out to me and offered a better solution. I was trying to get on Sublocade, but it felt overwhelming. There were times when I wondered if I could even really do it. But what made the hugest difference to me were the people that worked at DESC, the OTN staff, the case managers, the front desk people, like everyone pretty much. Everyone who took the time to check in, answer my questions, and just listen. And they had a lot of times listening to me, trust me. At first, I wasn't sure if I could trust anyone with something this personal, but over time, they showed me that they were really in my corner. They stuck with me through the rough patches, and there's been plenty of them, and setbacks, which was just a couple of them. And they never made me feel like another case or a number, like an actual person, which was nice, because a lot of times that's not the case. With their help, sticking to the medicine routine got easier. They didn't just tell me what to do. They walked me through it step by step, were patient, kind. And so it became a part of my life and my regular routine, which is still ongoing work. But, they showed me that getting better wasn't about being perfect, everything being perfectly, but it's about having people that around you that won't let you give up, even in the days you want to. And like I said, there's days like that a lot. I learned to trust again, which was nice, both in myself and in others. And that's something I never thought I'd say, really, especially with myself. To everyone at DESC who helped me to get this far, thank you. You made it possible for me to move forward, even though it was a long process for myself to get to that point, to keep going and to believe in the things that could get better. And for everyone who's just starting out, I want you to know it's hard, but you're not alone. And the right support, it does get easier. Thank you for listening.
All right, well, I feel really great, and I thank Royce and Taralynn and Executive Braddock and Mayor Harrell for speaking with us today, and really to all of you for being here and everybody who's got a hand in making this all happen. I'm just so proud to live in a community that takes care of people and can make things happen, and so I don't think I have anything more to say than that. So thanks everybody, and please enjoy.